I can do that.
Please, thank you.
Okay, we'll start with Dr. Wong. Dr. Wong, are you present?
Dr. Wong was having an issue with her computer, so she's fixed. She should.
Okay. I will continue. Roll call will come back at a moment. Dr. Turetsky?
I'm here.
Maria Salazar-Sperber?
I'm here.
Ms. Michelin? Rachel Michelin?
I'm here.
And
Here.
Ms. Garcia?
I'm here.
Dr. Chawla?
Present.
Was that an affirmative?
Yes, I'm here. Still having trouble with my camera, but I'm here.
Okay, got it. Ms. Brandvine?
Here.
Dr. McIntyre, myself, present. Dr. Kawaguchi?
Here.
Mr. Moridomi?
Here.
And do we have Dr. Wong yet?
Okay, but we do have a quorum, is that correct? I'm sorry, Deborah, we have a quorum?
Yes, we do have a quorum.
Okay, why don't we get started? There was one speaker that was overlooked in our last discussion, and moderator, if we can allow that speaker to speak and give her viewpoint, that'd be appreciated. Moderator?
Yes, I have unmuted Bonnie Delatorre.
Hi, thank you, board. Thank you very much for letting me speak. I guess I wasn't quick enough getting my comments in, but I wanted to back up Dr. Turetsky's about the taped videos. I found out from experience with COVID, I had a March program. When all this happened, I quickly taped all the lectures and put it online for an online. I found that most of the lectures tapes were short because without the constant interruptions, they didn't have enough material. Or during live events, when they're interrupted, at the end of their lecture, they're rushing through their slides to be on a timely manner. So full disclosure, I have 29 hours taped for June 1st through 4th with all the lectures taped, most of them done in our multimedia department in a very professional way, so they look more like a television presentation. But the presenters will be available for Q&A during the whole lecture. So you're actually getting more education than you get during the live education. And the people that want to ask questions, and you know, in live events, you always have that one person that dominates and asks a million questions, and all the other attendees roll their eyes. This way, the people that have questions can ask away, uninterrupting the other people, and they actually will get more education. The presenter won't have to be interrupted because of the taping, but can answer the questions during the taping. So I wanted to beg you, I have 100 people that are already attending, and I had advertised it as live CE because I misunderstood, because I thought as long as the instructor was there asking questions during the taped presentation, that is live. That was my first comment. My second comment, I had emailed some additional stuff to Mark regarding glaucoma grand rounds. I wanted to say quickly, after speaking with my glaucoma grand rounds people,
Thanks. Okay, sorry, so sorry.
Okay. They were saying that this would be a more efficient, taping it would actually be a benefit to the glaucoma learners. It would be a more efficient time, and they would have more interaction with the presenter and the patient, and it would increase the practical decision-making queries because instead of rotating 2 or 3 different groups between one patient, now they would have a solid hour with the patient. We talked to our multimedia department, and looking through the slit lamp, I don't know how many attended our grand rounds, but you would be in an exam room. One person would be looking through the slit lamp, and then the rest of the class would be able to see that. We were able to put that slit lamp image on the screen while they're looking at the patient. And it actually gives the attendees more time with the patient, a solid hour. That's all I had to say. Thank you for listening.
Thank you. And I'm sure the the CE committee will be interested in hearing your comments when they take this up again. All right. Let's move on with our agenda without objection. I'd like to jump down to agenda item 13 regarding our legislative calendar.
Mark, I just wanted to let you know I've managed to get my computer back on. Sorry, this is Lillian.
Great. Although the first question I have is, how many of these bills are actually moving, and do we need to comment at this point? So, Shara, do you want to give an introduction, or who wants to speak
Of
on
course, President Mordomi. So the beginning of last week, so 2 Mondays ago, the California State Assembly came back into session, and we were told spent a majority of their time referring assembly bills to committee. The state Senate came back into session this past Monday. It is our understanding that the governor has asked the legislature, and legislative leadership has concurred, to prioritize budget and COVID-related bills. We are not getting an indication from committees that we anticipate these bills will move quickly, but it is the legislature, and so if someone decides that it's an issue that needs to be addressed, these could move at any point. I think that it would be helpful for our work group on the AB 896 to perhaps give an update on those discussions and their determinations. But we're unclear as to whether or not AB 2028 Aguilar-Curry state agencies meetings and AB 2185 Patterson professions and vocations applicants licensed in other states reciprocity. We're unsure if those bills are going to move, but we do not currently have a board position. Again, that's on AB 2028 and AB 2185. We don't currently have a board position, an official board position on those bills.
So this is Mark. I just double checked. I just double checked on a couple of the bills that Shar just mentioned. It looks like AB 2028 is moving. It actually did pass out of Assembly Appropriations a couple of days ago. And AB 2185 appears to be moving. It was amended on the 13th as well. Those two bills are moving. It looks like AB 1263, that's still in Senate rules, so it's unclear if that's moving, and we have not heard from the author's office if that's the case, so the board may wish to take that into consideration.
So why don't you give us an update on 896, and then we can decide what to do with the other bills. Shara?
I will defer to Mark, our policy analyst, and our work group members, Dr. Wong and Dr. Turetsky. I was unfortunately not able to be a part of the last work group meeting.
Great.
Okay, I'll just jump in real quick, and then I'm going to turn it over to Dr. Turetsky and Dr. Wong for a little more insight into the changes. But we're continuing conversations with the author's office and also the Senate. The bill has not been amended since we last looked at it just yet. It's still in Senate rules, and we haven't heard if it's going to be moving or not, but we are continuing conversations with the author's office and with the Senate about this. The 896 work group, we did meet about this last week and had just come up with a couple of changes that would still allow the bill to be supported by the board, so it wouldn't require a change in our position of support. We wanted to, number one, make sure that all the optometrists in the bill that would be subject to this bill would be TPA certified. The second is that the list of optometrists that are available for follow-up care, the bill requires that these mobile optometric clinics would provide a constantly updated list of optometrists available for follow-up care. So we wanted to make sure that that list was updated every 6 months or so. The third is to just make sure that businesses listed under 3070.1 are not subject to the requirements of the bill. And I think this has already been addressed by subsection N. And then the other one is to have an exemption for federally qualified health clinics or community or faith-based organizations. And Dr. Turetsky, can you jump in and just fill in what your concern about this was?
Sure. My concern with this is that the bill was originally targeted towards one specific entity providing vision care services to schools. But the way the language was worded, it was going to make it impossible for certain entities like federally qualified health clinics, faith-based and charity groups that want to provide eye examinations or like veteran stand-down type of entities. They would be unable to operate the way that this bill was worded. So we're trying to get some wording in there that will allow FQHCs to still be able to provide mobile optometric care and be compensated for it, and to not make it so onerous that a veteran stand down or a Project Homeless Connect or something like that is unable to operate and provide free vision care services to folks who need it. So if we can get the wording that we need inserted into the bill, it should make it a better consumer protection bill, as well as a better bill for the optometrists who want to provide these services. Lillian?
I think you covered it all.
So is the board going to take any action with regard to this bill? Any further action, excuse me?
Well, Mark had to rewrite part of it, right, Mark?
No, we just have to work up some. We're in the process of working up the amendments that the committee that the work group has come up with. But I don't believe we need to take a motion to change or anything. The work is ongoing. So this is yeah.
Okay, great. Then let's move on to the next bill. Let's see now.
Mark, before you move on, can I make a comment? It looks like
Sure.
Ms. Mitchell also has a comment.
I'm sorry.
Yeah, so related to Dave, what you had mentioned, I'm in agreement with your desires. One of the things that we looked at when we last had a conversation about 896 was really hoping that this will be a catalyst for possibly future action. And so if we're unable to get the amendments in that you're proposing, I just think it'd be important that as this law rolls off, because it has a time limit to it, that we'll have to be diligent about using the experience to move those additional things forward. But I appreciate that feedback that you gave.
Member Michelin?
I just have a question. Did someone actually speak with the BMP consultant in the Assembly and Lowe's staff on what his intention is with this bill?
Well, Dave and I, and then staff met with, who did we meet?
No,
We met with,
I mean like recently, in light of, because my understanding is that especially in the Senate, the only things that the senators want to deal with right now are things related to COVID-19, wildfires, or homelessness. And then you now factor in the budget and the budget deficit and not knowing what's going to happen at the federal level. So my question is, before we spin our wheels on a lot of time on this, have we verified with Lowe's office and his staff that he's actually going to move this bill forward as it is, or is he going to reintroduce it next year?
Rachel, I reached out to Assemblymember Lowe's office last week and did not hear back about the intention of this bill. So we'll continue to try to find out the status.
Okay. Well, okay. I mean, have on all of these bills, have you verified with the member's office what their intention is going? Because there's been a ton of bills that have been dropped, and there's a ton of bills that have been gotten amended or going to be gotten amended to fit the criteria that especially assembly bills, because they know they're not going to get it out of the Senate. So I'm just saying, before we spend a lot of time going through all of this, have we called all of these members' offices and really dug deep into making sure that they're going to move forward with the bill, particularly because these are all assembly bills? So even Aguilar Curry, did we talk to Aguilar Curry's office? Because just because it's moving doesn't mean it's going to get out of the Senate, and it doesn't mean that they're going to necessarily take it up in the Senate. I'm just trying to save us time on our board meeting.
We attempted to, last week when we attempted to contact all of these authors, most of them it was shunted to cell phones, and most of them were, can you send us an email with your requests for given to voicemail? And I have not heard back as of late last week on the status of these bills. In looking on Ledge Info, the information that I gave about amendments, et cetera, that's the best information that I have been able to get. So if there's any other intelligence that anyone has, that'd be very helpful.
So if I can make a recommendation in light of time, I would recommend that, if we need, if anyone has a pressing issue on these bills, which I don't really think, maybe the 613 one, but if we need to, and we already have a support position, unless we have to change our position, I don't know that we really want to do anything on these bills right now, because my gut is that most of them aren't going to move. And if we have to have an emergency meeting, obviously now we can. If we need to take a position, we don't have to do all the posting under the COVID-19 stuff. We can certainly do that, but they're going to be focused on the budget now between now and June 15th. And they have to, that's going to consume everything. So, that's my recommendation.
And this is Maria. I agree with you, Rachel. I think that's a good plan.
I mean, I'm open to other suggestions. I'm just saying that, we can spend the next hour debating all of these bills, and it's going to end up being for nothing because they're not going to go anywhere. And if any of them have any appropriation to it at all, they're certainly not going to go anywhere. So that's just my suggestion.
Do we have any other comments as to that proposal?
I'm completely okay with that. It's Dr. Chawla.
Do we need a motion, or do we just, if we just don't act,
you just move on?
We can just move on, right?
Yep. You just move on.
All right. I want to allow people to disagree if they want to.
Mr. President, I just wanted to make sure, it appears that Dr. Kawaguchi has his hand raised, and just make sure there's an opportunity for him to make a comment.
Sure. Dr. Kawaguchi.
Sorry, I had to get myself off mute. So I'm fine with that. I just have a question around administration of this subject. Do we still need to take public comment on it before we close it?
Yeah, if you're going to move on without taking any action, you might as well still take public comment just to be safe.
So, Glenn, do you want to speak now or after public comment?
Well, that's what I had to say.
I think
I'll
that
take my
was
hand
his comment.
Oh, that was your comment. I'm sorry. All right, moderator, may we open the floor to public comment, please?
Of course, I have opened up the Q&A panel. If you would like to make a public comment, please type "I would like to make a comment" in the box and submit it to all panelists. We have further instructions on the slide.
Do we have any public comment?
We do not.
All right, why don't we move on to the next agenda item? Executive Officer, I'm sorry?
Sorry, Mr. Morodomi. We do have a public comment. John Valencia has a public comment.
Oh, I'm sorry. Madam Moderator, did you hear that?
Yes, I'm finding him in our list of attendees. John, you have been unmuted. Please.
Good afternoon, Mr. Chair, members. I won't keep you long. I agree with my comments relate to AB 896, and I represent VSP Vision Service Plan. We have made a recommendation for an amendment to the measure, and I've shared that with your board executive and staff. It's narrowly drawn to accommodate mobile clinic ownership by traditional 501c3, 501c4 organizations under the Internal Revenue Code. VSP, which, as you know, is a charitable provider of mobile optometric care in certain circumstances, is neither of those organizations, but it is a California nonprofit. In the event that there are second house hearings, and AB 896 is a Senate measure, pending in the Senate measure, and we all will see whether or not there is going to be action. It's an accommodation so that the bill doesn't inadvertently function to discontinue our charitable mobile clinic work. With that, thank you very much for your time.
Thank you. Madam Executive Officer, I believe we left off at 5B. Would you like to turn to that, or are there other items on the agenda that we should go to first while the members of the board are awake?
I believe that we can move to 5B. The remaining items, item 6, item 7, will not generate much discussion, I believe. Item 8, item 10 may generate some discussion. We may want to take up the immunization regulatory package. And then 11 and 12. So maybe it would be best to take up the presentation and discussion of research on telemedicine, and perhaps the item number 10, the update, discussion, and possible action on possible changes to the implementation of AB 443 immunizations.
Very good. So if someone would keep track as to the items we've taken and have not taken, because I'm getting mixed up a little bit, we will move therefore to item 12, presentation and discussion of research on telemedicine. Will there be a staff presentation first, or?
Yes, there will. If Mark and Brad, I think we will need Bradford Garding elevated to panelist, and if Mark will begin the presentation, he will then hand it off to the members of the work group.
Glenn, could you take the gavel while I step out for like 2 minutes?
This is the moderator. I've promoted Brad to a panelist.
Okay. Thank you, everyone. So this is obviously an issue with the coronavirus epidemic. That this is an issue that has really come up as a major issue going forward, and this is our effort to address this. Basically, just a short kind of brief history on the telemedicine issue. This was kind of on the board's radar in 2016, and it was actually raised by the legislature, identified in the 2016 sunset the need to evaluate emerging technologies in telehealth. It looks like not much was done after that. Unbeknownst to us in 2017, there was an outreach campaign developed, but it looks like it was not implemented. In 2019, at the prompt, we met with Assembly Member Evan Lowe and others. We began to sort of monitor the issue, and then at the August 2nd board meeting last fall, we had a very thorough and good presentation from Dr. Melissa Bailey and Dr. Jorge Quadros, and you'll notice that on your memo that their comments are summarized on the minutes. And we created a work group with Drs. Chawla and McIntyre to begin research. The work group we've talked. Staff has talked with both Dr. Chawla and McIntyre individually in the last couple of months on several occasions. And then we also did have a teleconference meeting with the work group and staff on Tuesday, May 5th, to discuss some of the emerging staff research, which we'll touch on in a minute. So the first thing I'd refer you to is just agenda item 12 on page 152. And it's a summary of the issues that Drs. Chawla and McIntyre felt were important to go forward. And I'll just summarize those real quickly. Both have identified the need to really focus on overall eye health as part of the telehealth, issue, and felt that refraction was a small part of the comprehensive eye exam, and that many patients do not understand the full scope of practice for optometrists and may discount the need for a health assessment for a comprehensive eye exam. Number 3, the existing technology to perform telemedicine may not be robust enough. And then another point about issuing guidelines for the use of telemedicine under the current Practice Act. I'd like to ask Dr. Chawla and Dr. McIntyre to elaborate further on some of these points, if they could, please.
Deborah, do you want to go first? Do you want me to go first?
I'll start.
Okay.
I think the first and foremost thing that we determined was that telemedicine does not adequately provide the care that is considered a standard of care for optometry. And that's the overruling guideline here. We cannot do a comprehensive exam. We cannot evaluate ocular health. We can't do a refraction over Eva. Sorry, was I not being heard?
I can hear you.
Okay, thank you. It keeps muting me. So overall, we do not see how telemedicine in this information
Deborah, we lost you again.
I know it keeps muting. I am unable to stay unmuted at this time. It keeps muting me without anything else happening. So I will try to say that again. Telemedicine in its current incarnation simply cannot, we simply can't perform the optometric duties that we would consider the standard of care for our profession. We can't do a complete ocular health evaluation, nor can we do a standardized refractive exam for determining spectacle or contact lens prescriptions. When we do these tests in our offices, we have specific instrumentation that meets a certain standard, a controlled environment in order to obtain those measurements. We have no way of controlling that environment if we're doing this online or via audio. It's simply not possible. Nor can a patient actually put a phone up to their eye for us to see the internal eye health of the eye. Yes, we maybe can see the front of the eye, but that's only a small part of an exam. So basically what we came down to is that we do see how telemedicine can fit in as more of a consultative aspect, where we have established patients, we know their history, we know their medical background. We're not meeting that person for the first time through an online kind of a situation. So we know them, we're familiar with their history, and we're able to make, good judgment calls with regard to treatment. Perhaps they're being treated already for something and we're renewing a prescription for medicine. I'm not going to go into the refractive component of that, because that's where we are really limited with regard to standardizing the way we can evaluate that. But again, just to sum it up, really, it's really only usable in a consultative method or mode right now, and not for complete ocular health exams and not for refractive exams. Dr. Chawla?
Okay, so similar thoughts, just kind of expressing them in a little bit of a different way. The way that we had thought about it was that, every time we talk about telemedicine, we get wrapped up in discussions about refraction, because that's the technology that people keep bringing to us, and then that's what we consider. Well, most people I know don't think that that technology is ready yet for a proper thing, and when it is, we can figure out what we're going to do with it. So that's one. So we didn't want to spend time talking about refraction, because Dr. McIntyre and I both agreed that it's just not there yet to get us what we need. Number two, as she mentioned, there's different kinds of things to do. The current kind of telemedicine, for example, that we're doing in my office is, if we're going to talk to people over the phone or do video visits, we are taking over from primary care, like the red eye patients that have, the basic things like the itchy, burny, watery eyes that you can address quickly over the phone. Maybe conjunctivitis, you can see them through the videos, maybe, if they can handle the technology and answer your video visit calls when you call them in. Or they'll send you pictures. Usually it's somebody, a young patient will send in pictures, no problem. Older patients can't. They have to have help, from somebody, but you can talk to them on the phone. And we've been doing that kind of thing, very, very simple things that aren't really threats to vision. And if there's any hint in the discussion that there is, they obviously have to come in. The third type that Dr. McIntyre was talking about is more the consultative piece, where a technician gathers information for you and you evaluate that data, and then you call them. You talk to them over the phone rather than seeing them, because they've already, for example, for macular degeneration, they took a vision, they scanned the macula, they took a picture, and you look at it. It limits the amount of time a patient will have to come into the office. Those tests are usually run very quickly, and the patient spends most of their time either waiting for you in their waiting room to wait their turn, or in your office, but you can do it safely over the phone, understanding that you're looking at only a certain part of the eye, and then again you make the decision: do they have to come back or not? And then one more comment about that. We were talking about the level of technician that was required to take that data, and that was Shara's concern, as to who's actually collecting the data for you. So that was kind of our overall discussion about telemedicine. The state of it is not there for comprehensive exams. And my primary concern, I think Shara and both Dr. McIntyre have mentioned, is the level of education the public has, because it's been talked about for years. When we talk about refraction, they think they're just basically getting an eye exam, and that's not the case. So that was the overarching concern from my perspective, that they understand what they're getting, and what we're able to do for them, as opposed to thinking, well, they addressed this problem in like kind of an acute fashion, and now I don't have to come back. So they need to understand what they're getting. They need to understand that refractions don't represent a comprehensive eye exam. They need to understand that they may still have to come in. And honestly, if we ever get to the point where we find a company that does a really nice job with refractive, doing like the refractive piece of the puzzle, we have to put in place like restrictions and who can do that? Are you going to let a 65-year-old diabetic do that over the phone? Probably not. So who are you going to allow to do that? It should be someone you've seen in your practice, someone who you're familiar with their health history, has had an exam in a reasonable amount of time. So these are kind of the ideas we were talking about. Mark Morodomi asked me like what next steps that we would look at. And to me, it's what can we do? How can we advise people on the consultative piece? Because I think in just conversations with my colleagues in the community, what are we doing? What are we doing that we can do over the phone so they don't have to come in, so we can maintain social distancing? And again, this can launch into like a future discussion about just telemedicine in general. But if you're, again, it's two pieces for COVID, what's essential, and then moving forward, how can we move that into like a broader thing for expanding access so people don't have to come in all the time, or they're coming in for shorter periods of time, and to make care more accessible. And I think the last comment is that as technology improves, where you might actually have some things that patients can buy, like patients who have glaucoma, we might have something. I know we have eye care, and it's like hit or miss. Some people say that it's a wonderful thing for patients to buy and check their own eye pressure. Other patients say, or other doctors say, what about corneal abrasion? So I don't know what the right answer is right now because it's relatively new. But patients may be able to purchase pieces of technological equipment where they can do some testing at home. But again, it's dependent on how good the equipment is and their understanding of what they're getting. So that's kind of the broad discussion we had. But I think where we can be impactful as a board is to just give out some guidelines, and just kind of direct people and like this is appropriate in a consultative fashion. And these are the things that we're looking at for the future. So I would love to hear from our other optometric and public colleagues on this.
Before I thank you. This is terrific. Before I go to the other board members, I have a question on the consultative piece. Are there any rules, regulations, laws that are currently in place that prevents the consultations that you described in your report?
If I may, Mr. President, our current Practice Act refers to the Medical Practice Act, and its provision says that it has to come with an established, that telemedicine cannot happen unless there is a waiver signed by the patient. The governor's executive order early on was to waive that necessity for consent so that doctors were able to call back patients who, or to contact first round patients in order to continue continuity of care. But there otherwise is not a law or a regulation around telemedicine that prevents that sort of consultative. It's just simply the consent of the patient prior to the treatment, but that has been waived currently for the COVID pandemic with the governor's executive order.
Thank you. Why don't we go through one round of the board members and then open up for public comment, because I imagine the public has things they want to weigh in on. So let me see. Looking at my WebEx screen, why don't we start with Sid? Sid, do you have any questions or comments based on what you've heard?
I'd like to hear from our doctors first, so if you can circle around, that would be great. We just lost Mark.
I'm on mute. I was on mute. Dr. Turetsky, I'm sorry.
Okay, a few things. As far as being able to do a comprehensive eye exam with telemedicine, here's a modified way of doing it. I have a classmate who does ocular investigative devices, and he works with ophthalmologists throughout the world. But there are a number of places who have partially reopened, a number of physicians who have partially reopened in other parts of the country. And they don't want to have direct contact with patients because of comorbidities that make them more prone to COVID-19. So they are having assistants in their office, having a patient come in, having an assistant do everything on that patient while they are observing through a video connection. So they're observing slit lamp, BIO, everything that's being done, and they're making real-time decisions and consultations for those patients. So it's a way of doing a modified type of telemedicine where you actually do have the physician involved, but not in the location. we can't do that because the law is not set up for that, but I think that's something to consider. That's number one. Number two, we've got our home health care bill that's already been passed and we're waiting on regulations. If we could move that along somehow, that would be a great way of making care more accessible to people. I mean, you could even do examinations in somebody's backyard under a patio. So there's, so you're in the open and you can actually do something for folks that require care who don't want to come into the office and who don't necessarily want you coming into their home. So there's things that we already have in the pipeline that we can get moving on that will increase access to care. And we can talk more about telemedicine as we go on, but let's do what we've already got done, and let's get it into practice. So those are my comments.
Dr. Kawaguchi?
So this subject of telemedicine is a very large one. So I'm going to step back a few steps. And the way that I would propose that we as a board look at telemedicine is like it's a project. And when you do project planning, there are several steps that you go through to make sure that you're doing things in a certain orderly fashion so that you don't miss anything. You can set short-term goals like Dr. Turetsky's mentioning, as well as longer-term goals. This may be a multi-step process from a legislative standpoint and or a regulatory standpoint, because for us to think that as a board we're going to tackle it all at once in one fell swoop is naive probably. So what I would mean by that is, for example, our initiated first step after the last board meeting was to try to do as much research as we could to understand what current laws exist, possibly also what current practices are going on within California. Once we feel that we've exhausted all the research that we would like to know as a board, then we would move on to analyzing that information. The work group, we would ask them to come back with a proposed interpretation or possibly next steps, whether it be additional research or start establishing goals for the project, whether they are multiple goals, short-term, long-term. So we're at kind of the tip of a gigantic iceberg, because telemedicine, the reason why across the U.S. there's a lot of variance going on is because it's like an iceberg. It's really large, and there's a lot of things that we can't see right now. But I think that's the biggest part of handling this project is we first really need to see as much as we can. Before we start solving things and coming up with opinions, we really need to understand what we're faced with in California related to laws as well as what's already in practice.
Dr. Wong?
Wait, I have a quick question for Dr. Kawaguchi. What are you doing in your practice?
Sorry, I was just checking if I was on mute or not. So I am functioning where I'm doing mostly in-person comprehensive care. The COVID pandemic has created a change where I am handling some patient care for established patients via telephone conversations and or conversations through my staff. So again, but that's my point, is that there's going to be lots of different things that are existing out there, and we need to get a really clear handle on what's currently going on, not just within our purview as far as our professional members' practices. We need to have a broad understanding also of practices that may be existing that we don't even know about right now.
Dr. Wong?
I agree. Telemedicine is definitely changing and it's developing. I will say that with COVID-19, things have changed considerably. So where patients before, I think, may not have been as accepting of telemedicine or even wanting an appointment like that, I think a lot of patients have adapted to it very quickly. I know that at Berkeley, we're doing telemedicine and we're doing it more as like Dr. Chawla and Dr. McIntyre talked about, more on a consultative approach where we're trying to triage patients who have red eyes, who are having problems with their ocular health problems. Sorry. In regards to refraction, I don't think that telemedicine is quite there yet. And when that day happens, it's something that definitely the board needs to investigate and then give their opinion. But as of right now, telemedicine is definitely, we should give some guidance because it's something that is definitely being used right now, not just for optometry, for all the MDs are also using, a lot of people I've talked to are using telemedicine in their practices also, because this is one of the few ways that we can really help patients without having to put people in danger. So telemedicine definitely has grown significantly in the last 2 months.
Member Garcia?
I'm really excited about this topic, and I did just a little brief research about our concerns as opticians. We're getting involved too, and we look at privacy and documentation and getting some consent from patients. I think we need to do more research about the telemedicine, the units that are being used, because how is this going to be tracked and stored for the future? Everything needs to be documented. Not only that, but the training to be able to use these units. I'm also a little bit looking into the alignment between opticians and optometrists. Optometrists go to school for years, 8 years, whereas opticians here in California, we're not required to. It's an individual choice if we do want to, but there's nothing really established on the educational part. So where is our training coming from? And how can we get closer to aligning to what optometrists expect from us? We have to know everything about assessing refractions. Do we even understand that, and how are we fairly being evaluated in that? So I'm concerned about the training. I did find something just quickly online with another state, and that is the state of Kentucky. They do have some online tests, but they do have limitations where they indicate that consumers can use the technology, but they have to be at least 18 years of age. It's got to be approved by a licensed optometrist in Kentucky. And it also does not permit patients to use any online exam for initial contact lens prescriptions or for renewing the contact lens prescription. So it seems like the other states are looking at it too. I just think that there's got to be some more research.
Thank you. Let's see now. Member Sperber.
Thank you very much. So I echo Dr. Wong's comments and also appreciate the training component. I do want to emphasize that telehealth is really being used statewide. Again, in the medical profession, I know that in the shortage with regard to behavioral health professionals, the medical community is joining together to find ways to help mild to moderate kids with behavioral health issues. And I would say that if other medical communities are finding a way to use telehealth, that this board should really look at it very seriously, start looking at it prudently, clearly, but also pretty quickly. I think it's something that is here to stay, not unlike our technical conversation with regard to CEs online. I think it's really important. I think it's relevant. I think it's not going away. I would also emphasize that the training is really important. I think it will be front-loaded, pretty heavy training in the beginning, but as practitioners become more familiar and the expertise is there, I think we'll see that our optometrists and this community will not need as much training. I just think it's something that, again, is not going away. I think we definitely need some guidance.
Member Michelin, anything?
I totally agree with what Maria just said. I think that when you look at, healthcare going forward, I think telemedicine is here to stay. I think we need to figure out a way to adapt. So I just wholeheartedly agree with her comments.
Member Randvine?
Yep, thank you. So several of the points that I jotted down when I reviewed the packet have been answered. So Dr. Wong, that's what I wanted to hear. What is the medical profession doing? So it is clear that the use is increasing, and especially during the COVID period, because how we bridge care over extended periods of times, it's our responsibility to help address covering that bridge period and also making sure that those who need care can get care at a time when not everyone feels comfortable getting into an office, whether for a whole variety of reasons. So telemedicine is growing. It is here to stay. And how it has evolved over the last few months has been rapid. It's harder to go backwards, but how do you go forwards with the right training, et cetera, without making it the primary vehicle to diagnose eye health? But is there something in the interim, such as someone desperately needs to get in because they've got just vision issues? And I understand that it's difficult to tell whether it's the symptom of something greater, or they might just need to go pick up a pair of glasses or have, and that's what I'm wrestling with, is the extended period, accessibility, training, and where the profession is going overall. But it's good to hear that some of the doctors are embracing it, particularly with your clientele base that you know, because this is our version in this century and this particular time of a house call, if you will, because they can't do what Dr. Turetsky said. We can't assume that people are going to allow us into their homes for a comprehensive eye exam.
I saw that Dr. McIntyre had her hand up.
Yeah, I actually have a few things I want to address here. With regard to what Sid was just saying, if a patient has a vision issue, it just really depends on why. Did they suddenly lose their vision, or did they just lose their glasses? And our regulations already make a provision where if someone has an expired spectacle prescription, they can, in an emergency situation, get that prescription filled, with the understanding that they're going to seek a full exam at their earliest opportunity. So there is something there in our regulations. I think what we need to do as the board, like some of the other healing arts boards are doing now, we need to define what telemedicine is to us. There are different categories. There is telehealth. There is telemedicine. Those terms are being used interchangeably. They're not the same thing. Teleoptometry is a new word that we need to add in there. So we need to define these things. And that's what our work group will start working on. And as Dr. Turetsky was talking about, he was referring to where there's a technician who's performing the exam and there's a doctor available video-wise to evaluate the results of that exam. That's just one leg among many of the legs this has. I feel like it's the optometry octopus because there's so many parts to it. There are different forms of the telemedicine, I guess you could say. We'll use that term for the moment. There's remote, there's synchronous, there's asynchronous, and all of that has not really been defined for us yet. I've been reading about it so I can understand what those terms mean, but we need to define them for ourselves and our board. And I think that's our first step. So we do the definitions and then we take the first step. And that's referring back to what Dr. Kawaguchi was saying. Yes, we need to lay out a plan and go, we'll address this first. Here's our next step. Here's our next step. And that will be a big work group item to do. But I just wanted to point out those issues so you understand that the definitions are the first thing that we need to do.
Does any other board member have their hand up? This may not be parallel with what Deborah you just said, but as a lawyer and regulator, the way I perceive our world, our world is, well, something new is coming up. As a regulatory agency, are we getting in the way? Or two, is it something we want to support through our regulations? Or three, is it something we need to regulate because of consumer protection issues? So that's how I view things from a lawyer's perspective. Madam Moderator, do we have any public speakers on this item?
Mark, I had a quick comment just to address what you're saying.
Sure.
That is what you're describing is kind of like we have to do all of those things, right? We have to not get in the way, but we do have to protect the patients because that's what you're here for. And I think that there's an avenue to do that. And with regard to Dr. Kawaguchi's comment about collecting more information, we can do that. We just had a few conversations to get going. So if any of the professional or public members have information for us as to what they're doing in their practice, that's why I asked Dr. Kawaguchi what you were doing. Just, to see. But if people have more information, we're happy to take all of that into account. But yeah, we have to, I think you have to get out of the way, but you also have to remember that you are a consumer protection board. So you're here to make sure the patient is getting the quality of care, providing them the access that they see you in person. So that's kind of the focus of the group. Let's hear from the public.
Before we take public comment from those who are participating today, we wanted to turn attention to the public comment from the National Association of Optometrists and Opticians that was received yesterday. Board members, this was sent out to you last night. Members of the public, we have some of the synopses available of that comment on the PowerPoint presentation that's shared with you today. We will also post those letters to meeting materials after the conclusion of today's meeting.
Okay, now we can go to public comment.
Okay, this is the moderator at the direction of the board. I've opened the Q&A feature for public comment. If you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your screen. And we are sharing instructions for that now. Please type in the ask field that you would like to make a public comment and send it to all panelists.
Do we have any people who want to make a public comment?
We do. Right now we have one. Chad, I will let you know when you have been unmuted. Chad, you have been unmuted. You have 2 minutes to speak.
Thank you all for this discussion. I'm Dr. Chad Overman. I've been a consultant for the last 5 years and have been working a lot with telemedicine. You're touching on all the right questions. I think you still have a lot of questions and need of information. But much like I've been listening all day to your meeting, and much like technology for your CE, there is new technology out there that I don't think you're quite aware of yet. It does go along the lines of what Dr. Turetsky was saying slightly. But I'm completely interested in a full comprehensive eye exam, but we oftentimes mix up the refraction and online with the comprehensive eye exam. So it's available now. You can do comprehensive eye exams. I know there's at least 15 states that it's being done in right now. I would love to be more of an informative person for all of you. But Member Sperber, as you said, it is here to stay. And I'm thinking more after COVID, not currently while we're in it, but this is giving the opportunity for patients to get used to it. I think going forward, they're going to expect it a little more. And it is a way to provide quality, affordable accessibility in the eye care world. It's not going to take care of every patient. It will not As an optometrist, I want people to see optometrists also, but there's definitely a place for this. And if we regulate it out, that's what I'm worried about, because
10
ophthalmology will take
seconds.
it away from us and we're going to lose as a profession. Thank you for listening, and I'm available for any questions.
And now we'll go on to the next person that would like to make a public content. That is Christine Schultz. So Christine, I will let you know when you have been unmuted. Christine, you have been unmuted. You have 2 minutes.
Great. Thank you so much. Christine Schultz, representing the California Optometric Association. I appreciate the boards doing the research necessary and having this conversation here today. COA's position on online refraction is identical to AOA's. The current technology right now, that I'm aware of at least, does not allow for all the tests required by the current standard of care. Regulation should be simple. You just require the standard of care be followed, and that you discipline optometrists that approve prescriptions without meeting that standard. COA strongly supports telehealth. Now online refraction, the way it's being used now at least, is not that. It's a workaround, and it doesn't bring patients and doctors together, which is really the intention from telehealth. So with those comments, I'll finish. Thanks so much.
Thank you.
Do we have anyone else?
We do not have anyone else in our question and answer panel.
Thank you. You can close the public comment.
Thank you, Board President.
So board members, what are our next steps? It sounds like Dr. McIntyre and Chawla are willing to stay on as the telemedicine, teleoptometry, telehealth working group and continue their work. Perhaps they've given some suggestions as to the next steps, but if we can, as a board, refine it for them a little bit further, I think they would appreciate it.
A quick comment, Mark.
Sure.
Yeah, we're really looking to see what you all are thinking, because we really haven't done a lot of work. We just did it in the last few weeks. As we were going to start doing these things, COVID erupted. So, we had to take care of our own practices. The board had to figure out what it was doing and how it was even going to function. So we just started, really. So whatever ideas you have to gear us towards public safety, public health, but still utilize whatever technology we can to best help our patients now and in the future is appreciated. So whatever your thoughts are, aside from gathering more research, and coming up with next steps, we were already thinking about that. But whatever else you can do, or if you have more specificity under those two, categories, we're open to that too. So just let us know. We're happy to do it.
I would personally like to know at some point what regulations get in the way, or what current regulations or laws get in the way of telehealth, just as a kind of a starting point for my analysis. But any other board members have any comments, suggestions? Member Sperber?
So I think that what I heard earlier was, a sense of privacy. Obviously, that needs to be vetted, just the privacy and of our patients and sharing of information. I would personally, at this point, recommend that we consult the medical board, the dental board, some of our other licensure boards, and see how they have developed their telehealth protocols through COVID. I think it could be really interesting to see. I'm sure they have a lot more information since the last 6 to 8 weeks than they would have had when you started this conversation. So maybe that would be a good starting point, in just consulting with our other boards and seeing what kind of roadblocks they have seen, how it worked, what worked for them, what doesn't really work, and just kind of go from there. Again, I think the information that is accessible at this point between the last 6 to 8 weeks could be really helpful.
If I could just President Mordomi, I just wanted to just direct folks that I think that Ms. Sperber makes a very good point. The data that could be collected that has been collected in the last 6 to 8 weeks could be very informative and very much change the conversation. I do want to refer folks back to the staff research that did begin in August when the work group was created and continued until March, and just previous to the outbreak of COVID. Just want to recognize the research that's done there, that we have looked into the previous publications and previous actions of the medical board and the dental board. Just want to recognize the months-long work that staff has done to put together the research report that you have in your packet. But I think that Ms. Berber makes an excellent point that this last 6 to 8 weeks, as we've been in, working through the COVID pandemic, is going to be very informative. And I think there are some additional conversations definitely to be had with their staff that can change the conversation.
Thank you. I have Member Garcia and then Member Wong.
Yeah, I like what the work group is doing, and I'd like to see how can we get more research, because as from the standpoint of opticians, I'm pretty sure we're going to be involved, or we are already involved. And how could we maybe provide research or provide questions to answer? Because even in this letter from the National Association of Optometrists and Opticians, they addressed registered, non-registered opticians being involved in telehealth. So how could we create a path to be able to provide the work group, or should we come up with some ideas of research that is needed for this? I think it's an exciting venture that we're going to have, and the more input we can provide the work group or to the board would be very helpful. So I'm just curious, how can we provide the information?
Mr. President, I just wanted to bring to your attention that Madam Brandvine and Dr. Kawaguchi have also raised their hands for comment.
All right. So, Sid, why don't you go after Lillian, and who's the next person?
Kawaguchi, Glenn.
And then Glenn after Sid.
No, I just want to agree with Maria. I think talking to the other boards is a fantastic idea. And like I said, I've talked to enough people who've done a lot of post-op follow-ups on via Zoom that they wouldn't have done beforehand. And I just also, in regards to privacy, I want you guys to know that Zoom, well, at least Zoom, and I'm assuming some of the other platforms also, have come up with more secure links, I guess, because I know that Zoom now, we at Berkeley are using one that's HIPAA, that's much more HIPAA compliant. So there's definitely protection of patients' privacy that was not in existence prior to COVID.
Sid?
Unless you use one particular platform which has been data compliant with laws around the globe, I'm comfortable with learning more about where data is stored. But what might be helpful too is just get a running list by state, and let's look at who has telemedicine laws, who doesn't, pre-March and then post-March. Then we can pick and choose who maybe we would like to read in depth, what some of those laws and regulations are, and if something was temporary or permanent. It might help us through the balance of COVID, but it might also give us a baseline of what other states are thinking as they move to medicine, telehealth, teleoptometry, posture. That's it.
I think that if I may,
yes,
sure. Just that we did reach out to the Association of Regulatory Boards of Optometry, and that was historical data. We can make that available in the final posting of documents for the meeting, and then we will, of course, go back out. In fact, I think we've got a meeting of executive officers across the nation early next week, and so we'll certainly put out the question of, we've seen what you have been doing, but how has that changed over the last 6 to 8 weeks in COVID? How have you changed your telemedicine approach, and what is it, through executive orders that has occurred in your state that might cause, have allowed a larger embrace of those technologies?
Dr. Kawaguchi?
Yes. So I would look at this with 3 big categories of next steps. One is current law, as it relates to what everybody's been talking about so far, which is an interpretation of our current laws for optometry in California and how it applies to our practice? Are there opinions from the work group about risk points, as well as others? So to Maria's point about getting information from the med board, dental board, to Ruby's point about other states, but what we're looking for is the work group to make an assessment on what they're hearing exists out there that they feel are items maybe that we want to consider, and explaining to us why. The second big category would be to what Dr. McIntyre said, which is really helping us to clearly understand definitions of terms so that we're not intertwining terms mistakenly, that we start to get consensus as a board of how we're going to use the terms, how we're going to define them, so that way as we roll through discussions over the coming months, possibly years, we're still always on the same page and that we're not confusing each other. And then third point, and Maria brought this up earlier, is we do know that there's current urgencies, that things are changing really rapidly right now. And so a recommendation from the work group about things that might be easy fixes or easy actions that we can take as a board, whether it's something as simple as education through our website, or initiating suggestions to practitioners. It doesn't really matter, but if there's certain things that the work group can suggest to us that are easy fixes that we can do quickly, I think that that would be great, because we know that to my earlier point, the subject as a whole is very deep and broad, and we don't want to try to accomplish more than we can handle all at once, and we're always going to be at risk of going down a rabbit hole, taking a left or taking a right, and losing focus if we don't have really clearly defined goals by the work group. So I'm going to ask the work group to be really clear with us all the time, every time they come back to us, of here are our current goals, so that you don't allow us to go down different rabbit holes, because we definitely can do that, because things will pop into our heads and we can take it in a different direction, and that might not make us productive.
Do we have any further comment from members of the board?
Dr. Charla does have her hand raised.
Oh, okay, sorry. Dr. Charla.
Sorry, it's okay. Somebody else already covered what I wanted to say.
Okay.
I do.
Ruby?
Yes, I just, once again, it is a big task. I don't want to feel that the work group has to do it all. And if there's anything we can do to assist them, it'd be great to have, as everyone is commenting, to have like an outline and things that we have already, like Dr. Kawaguchi just stressed. Let's see what items we need to address and see how we've addressed everything. But again, the work group should not feel overwhelmed. We're here to assist them as well.
I think, board staff does a great job for us, collecting a lot of stuff. So it's not just me and Dr. McIntyre. So they're carrying the heavy load.
So I don't think we need to take a vote on this matter. I'm assuming that the work group has and staff have enough from this discussion to at least take one or two steps forward. Sid, did you want to say something? I saw your hand raised.
Thank you. It's rather ironic. I just got a breaking report from McKinsey on the future of healthcare, et cetera. So I just decided to tap on it. And acceleration of the online offline integration, which leads me to, without reading everything about the digital first front door for various health services, and I'll read it all later. Perhaps maybe we can pull out some of the forward leaning and looking articles that are being written from thought leaders just in the industry overall, so that we can level set, not just from a regulatory standpoint and what the health industry is saying, but what it may look like in the way of this total disruption that's occurring. Might have some interesting information, and I certainly don't mind passing this along to the board office to get to us.
So can we move on to the next item, or does the working group need have any further questions for the board? Okay. let's complete that item. Executive Officer Murphy, shall we move to item 11?
We can very quickly move through item 11. We want to make sure that we get through item 8 today. We will need an adoption of the comments from AOL and legal counsel on the implementation of 2138. The presentation on, pardon me.
Let's move to item 8 then.
Okay, great.
Go for it.
So for item 8, we'll call up our regulatory legal counsel, Danny Rogers, and also Mark Johnson, our policy analyst, and also Will McGuire, our board appointed or DCA appointed legal counsel.
Hi, Mark. This is Danny. Would you like me to take the lead?
Yeah, Danny, please proceed. Thank you.
Good afternoon, board members. This is Danny Rogers. I am here to present 2 items today that relate to regulations. The first one is agenda item 8, and the second one is agenda item 10. I'll start with agenda item 8. Mark has ably prepared a great memorandum on this that is very detailed in the text modifications that we are proposing to the regulations. These text changes are informed by previous experience with the Office of Administrative Law on another regulations package. You will see the items in light blue highlight represent changes that are viewed to be non-substantial, meaning that if we weren't coming before you, Executive Officer Shara Murphy could approve these if changes have been delegated to her. The highlighted yellow changes represent changes that would be considered substantial. And if adopted, would require an additional 15-day public comment period. So to the extent that you adopt all changes today, in order to satisfy the Administrative Procedure Act, we would need to go out for another 15-day comment period, after which time we would finalize the package and review it on our end and get it ready for submission to OAL. The other piece of the memorandum is the proportion or the portion devoted to responses to comments, which we only received 1 letter, and so those are detailed at length in the memorandum. I'm available to take any questions that you have. I can certainly go through each of these items. I'm not sure if time permits, but I'm happy to do it that way as well. So I will leave it to Executive Officer Murphy to steer me in the direction that you prefer.
I think I just want to say just a little added comment, and then if there is a desire by the board, I think we'll just take a poll to run through item by item, or if we feel like these are changes that are coming from AOL and from legal counsel and should be adopted. I just want to make sure that we mention that the letter of comment that we received, we certainly looked to address. And I think that it really got at the spirit of 2138, which is writing, systematic injustice and giving folks an opportunity to improve their lot in life through licensure. And we as a board have dealt with that really head on in seeing some of our opticianry skills for our licensees learned within the prison system. And so I wanted to make sure that folks saw that folks knew that we have taken some extra steps to particularly enact the spirit of the law, and want to make sure that although we have chosen to not take the suggestions within this comment letter, to know that we have taken the spirit of that and gone beyond just the implementation of the requirements to really think about how we are allowing licensee or potential licensees, applicants to demonstrate their rehabilitation. So in particular, one of the comments within the comment letter was a desire to list out particular pieces of information or particular documents or particular attestations that could be used to substantiate a rehabilitation claim. We have chosen not to take on that list because our current language within the regulation does not specify, and in fact allows for a broader variety of substantiation to rehabilitation. So I wanted to make sure that folks knew that, we received one comment. We are not taking those suggestions, but that we really have looked to what it is the intent was with that comment letter, and have already been working through trying to adopt 2138 and its opportunity to, or its desire to expand opportunity within the regulatory language that we have previously adopted.
Thank you, Shara. Yes, actually, that's very helpful. I read through the comment letter. One of the comments that was interesting to me was, well, we should reproduce the rules in the statute in the regulation. And I've worked at regulatory agencies where we've done that, and it makes the regulations like 10 miles long. And real people don't read regulations. Lawyers do, bureaucrats do. To the extent that we want all the rules and guidance in one place, staff or this organization, we can work with them to create a cheat sheet, a fact sheet, guidelines that speak in plain English that will help real people navigate through the laws and regulations. So I don't think it's a good idea to dump everything in the regulations. With that, do any of the board members have any comments? Personally, I don't think we need the regulatory staff to go through the comments, comment by comment, line by line. I read their comments to the bubble comments to the draft, and I thought they were very helpful. So why don't I open it up to the board to ask any questions or make any comments? Member Van Vine, nothing. Dr. Turetsky, Dr. McIntyre, Dr. Kawaguchi.
No comment.
Dr. Wong.
No comment.
Member Sperber.
No comment.
Member Garcia.
No comment.
Dr. Chawla.
No comment.
And is Rachel still there?
Yep, I'm still here. No comment.
Okay. So given that, Madam Executive Officer, should I just ask for a motion to adopt the changes?
I would believe that would be our next step, and then opening for public comment on that motion.
Oh yes, thank you very much. So I would entertain a motion to accept the changes as specified in the board materials. Do I have a motion? Anyone?
This is Dr. Kawaguchi. Dr. Kawaguchi so moved.
Do I have a second?
Dr. Wong will second it.
All right. Moderator, would you open up the floor to public comment, please?
This is the moderator, and I am opening up the question and answer panel at the request of the board president. The Q&A panel is now available. If you would like to make public comment, please click on the icon with the question mark within a square located at the bottom center of your screen. We're sharing instructions if you need a reference. In the ask box, type that you would like to make a public comment, and please send it to all panelists.
Do we have any public comments?
Not yet. Might want to give it a little more time. I am seeing no public comments.
In that case, moderator, would you close public comment?
Yes.
I'll open the floor up to the board if they want to have any further commentary. Seeing no hands raised, I'd like to call for a vote.
I will first call on Dr. Wong.
I'm so sorry to interrupt. Just for the sake of the regulatory package and the rulemaking, can we have it clear that Dr. Kawaguchi is using the motion as listed in the staff memo?
It's motion number 1.
Oh, yeah.
Which is approving changes to the text and allowing a 15-day public comment period.
Dr. Kawaguchi, can you confirm that?
It's on page 85 of our packet.
think Glenn is looking for it. I am too. Does he need to actually say those words, or can he just incorporate by reference? Glenn, you're on mute.
If you don't mind,
Motion number
it's cleaner for the regulatory rulemaking record if you do.
And to clarify, we're seeking motion number 1, correct?
Correct.
Okay, so just to clarify my motion, well, actually, I retract the former, and I'll create this new motion. Direct staff to take all necessary steps to complete the rulemaking process, including sending out the modified text presented here today with these changes for an additional 15-day public comment period. If after the 15-day public comment period no further comments are received, authorize the executive officer to make any non-substantive changes to the proposed regulations and adopt the proposed regulations as described in the modified text notice.
So, Dr. Wong, do you second that?
And I second that.
All right. I think we're ready for a vote.
Start with Dr. Wong.
Aye.
Dr. Turetsky.
Aye.
Ms. Salazar-Sperber.
Aye.
Ms. Michelin.
Aye.
Ms. Garcia.
Aye.
Dr. Chawla.
Aye.
Ms. Brandbein.
Aye.
Dr. McIntyre, myself, aye. Dr. Kawaguchi.
Aye.
And Mr. Morodomi.
Aye.
So
Motion
moved.
passes. All right. Sure.
For the sake of presentation, if we could move to item number 10, and we'll have Danny continue her presentation, as this is the other regulatory package she's here to speak to us about today.
Very good.
Shara, let me jump in. We do need to take a second motion, please, on the board responses to the comments received. This is also to complete the regulatory package for AB 2008. And the proposed motion is on page 90 of our packet.
Would someone make a motion?
Oh, I will make that motion.
I'll second that. This is Dr. McIntyre.
Do we need to have something read in the record again?
We do need the text read in the record, so it is available on the top of page 90, motion number 2, board responses to comments received.
I can repeat that motion if you'd like.
That would be great if you could.
The motion is to direct staff to reject the proposed comments, provide the responses to the comments as indicated in the meeting materials, and complete the regulatory process as authorized by motion at the board's January 13th, 2020 meeting.
Do I have a second?
I'll second that.
Well, I think we'll just flip that, since Deborah, you read out, you could be the motion, and
I'll
Dr.
move.
Wong, if you'd be the second.
I will second it.
All right, let's vote.
Okay, Dr. Wong.
Aye.
Dr. Turetsky.
Aye.
Ms. Salazar-Sperber.
Aye.
Ms. Michelin.
Aye.
Ms. Garcia.
Aye.
Dr. Chawla.
Aye.
Ms. Brandbein.
Aye.
Dr. McIntyre, aye. Dr. Kawaguchi.
Aye.
And Mr. Morodomi.
Aye.
So moved.
Okay, motion passes.
I have one question on this. So we just approved a motion approving a prior motion from January 13th. I just wanted to make sure that that's what we need to move this forward, as opposed to approving our motion or discussing our motion from today.
Yes. I believe you are correct, Dr. Kawaguchi. So if you would, Dr. McIntyre, if you would read through that text again, but change that final date to the board's May 15th, 2020 meeting, then we would be aligned with what we are approving.
I apologize for not catching that earlier. Direct staff. I move to direct staff to reject the proposed comments, provide the responses to the comments as indicated in the meeting materials, and complete the regulatory process as authorized by motion at the board's May 15th, 2020 meeting. That is the motion. Do we have a second?
I will second that one too.
Thank you.
Wait, before we vote, Will, do we need to do something about that last motion that was that was just passed a moment ago? Do we need to rescind that earlier motion, or it was just?
I think we can talk about technical difficulties, but if you want to make some sort of statement on the record, President Mordomi, just to clarify that that was just a equivalent of a typographical error, and you're rescinding that motion and going forward.
So we are correcting that earlier motion, and so that will be incorporated in your vote. When you vote yes on this motion, you are adopting this current motion and rescinding that prior motion. Does that work, Will?
That works for me.
Call the roll. I think we have to vote again. Yeah.
Yes, we'll take the vote. Dr. Wong.
Aye.
Dr. Turetsky.
Aye.
Ms. Salazar-Sperber.
Aye.
Ms. Michelin.
Aye.
Ms. Garcia.
Aye.
Dr. Chawla.
Still voting aye.
Ms. Brandwein.
Aye.
Dr. McIntyre, aye. Dr. Kawaguchi.
Aye.
And Mr. Mordomi.
Aye.
Motion passed.
All right. Now, can we go to item 10?
I do believe so. Danny, would you take over again?
Item 10. It's the regulatory council. Yeah, go ahead.
Hi, this is Danny. I'm having some audio difficulties. One moment. I'm trying to put my AirPods in. There we go. Thank you. This is Danny Rogers again. So I'm here to present item 10, which relates to proposed changes to Title 16, Sections 1524 and 1572. And you may recall that AB 443, which was effective in January of 2018, allows a licensed optometrist to perform specified immunizations after meeting certain requirements. The board approved the regulatory text and the form in 2019 and directed staff to begin the rulemaking process. And just as background, I got to the department in October of 2019 as part of a regulations council team of 6. And at that time, board counsel to the Board of Optometry largely transitioned regulation work over to my team. And so it got a new pair of eyeballs on the package, mine. And I just saw a couple of tweaks that needed to be added. It just so happens that I have drafted this package and sent it to the board staff already. And all it really needs is your blessing on the revised language. And I'll just run through those real quickly. The first set of changes relates to the regulatory language in Section 1572A5. And the point of this new subdivision was simply to add a declaration by the applicant that they will comply with state and federal record keeping and recording requirements and various other things. Business and Professions Code Section G1C has this requirement, so I thought it would be helpful to add a means by which the applicant can attest that they're following the statutory requirements in the application. And the second category of changes relates to just various tweaks on the form, which are immaterial, just a few minor tweaks there. And I think that covers it, and I'm happy to respond to any questions you may have.
So I have a question. At some point, I would like the legislature to change the law on immunizations to allow optometrists to give immunizations for COVID-19. When we go forward with that, and get those changes, what effect will that have to these regulations? Will we have to redo these regulations again, or will these regulations be effective for giving COVID-19 immunizations?
Thank you, Board President. The response to that question is, number one, as you've recognized, the current statutory language does not permit the administration of immunization for COVID. It's not in the statutory language. Should the legislature act and add an additional category of medication that can be administered, medication or immunization rather, what we would then do is do what's called a Rule 100. And a Rule 100 wouldn't require us to go through 45-day public comment or the more lengthy rulemaking process. It would simply be a rather ministerial change to the regulation and to the form that could be acted upon fairly expeditiously by the OAL. So I don't foresee any issues there. I think it would be a much more streamlined process once legislative action were passed or taken.
So streamline means how many months or days?
Oh, let's see. So Rule 100s, I don't know the submission time period off the top of my head. I do believe it's 30 days, but the one thing that is removed from that process that takes a lot of time is the 45-day comment period and the ability to have public comment and public hearing. It's simply a ministerial review by the OAL that doesn't require any kind of public comment or public hearing. So that is the portion that is streamlined.
Okay. So how long would it take?
As a matter, just as a matter of context, I think, Danny, I'm so sorry to interrupt you. You're struggling for timeline. The biggest thing, though, is that the immunization authority that is currently in statute was hard fought for. There are, such as in pharmacy, a schedule of immunizations that they are able to give rather than enumerated particular immunizations. And we had some very, very, intense and in-depth conversations with stakeholders. And so it would really be around the legislative will to do this and other stakeholders in other healthcare professions, their willingness to really allow this sort of extended scope for optometry. So I think that our short timeline is on the issues that Danny has discussed. Our long timeline is reopening those discussions with key stakeholders in healthcare about whether or not an optometrist scope should include all of the immunizations that are upon the schedule that's open to pharmacists and other healthcare professionals.
Okay.
I think Dr. Turetsky also just raised his hand.
Yes, I saw that. Dr. Turetsky?
Considering that nobody knows what the hell's going on with the coronavirus and what's going to be necessary with an immunization, with a vaccine, it might be a multi-step process. There might be certain monitoring that's involved with it. I think it would be premature for us to get involved in throwing something like that into legislation. The stuff that's out there, influenza, shingles, things on that order, those are well-known vaccines. We might try to get something in there, and as was stated, we're going to have pushback from a lot of other entities that it might be overstepping our bounds at this point until this immunization is better understood. So I would recommend not pushing for anything involving COVID-19.
All right. Do we have any further or other comments or questions related to the regulatory package?
Hey, it's Rachel. I have a comment.
Sure. Go ahead. Yes.
So kind of piggybacking on what Dr. Turetsky said, I do know that in other instances with COVID-19, and correct me if I'm wrong, I know with the pharmacy board and pharmacists, they were able to get testing for COVID by a special waiver through Department of Consumer Affairs. So I'm thinking Dr. Turetsky's correct. We should just kind of wait and see, and if we need to, and I think once the vaccine comes out, we can kind of cross that bridge when we get to it.
All right. Do we have any other comments from the board? I don't see any hands being raised. All right. Well then, I would entertain the requisite motion to move this regulatory package forward. Do we have magic language that we need to read? Oh, here it is. It's on page 113. Would someone make the motion? Please.
This is Dr. Kawaguchi. I move to approve the form incorporated by reference in Section 1572, Title 16 of the California Code of Regulations with the edits discussed here today, as well as approve the proposed edits to the text of Section 1572, Title 16 of the California Code of Regulations as discussed here today, and direct staff to resubmit the text to the Director of the Department of Consumer Affairs and the Business, Consumer Services and Housing Agency for review, and if no adverse comments are received, authorize the executive officer to make any non-substantive changes to the rulemaking package, set the matter for hearing.
Do I have a second?
I'll second this, Dr. Chawla.
Great. Any further discussion by the board? Could we take a vote, please?
We'll start. Dr. Wong.
Aye.
Dr. Turetsky.
We should
All
have
right.
some public comment before we.
Oh, I'm sorry.
Okay.
I'm sorry. Moderator, could you open the floor to public comment?
This is the moderator. I am opening up the question and answer panel. It is now open. If you would like to make a public comment, please click on the icon with the question mark within a square located at the bottom center of your screen. We're sharing instructions for your reference. In the ask field, typically in the lower right of your WebEx screen, type "I would like to make a comment" and send it to all panelists. Thank you.
Do we have any comments? Speakers?
We do not.
Okay.
Shall I close the question and answer panel?
Yes.
Thank you.
My apologies, board. Now we can take a vote.
Dr. Wong.
Aye again.
Dr. Turetsky.
Aye, aye.
Ms. Salazar-Sperber.
Aye.
Ms. Michelin.
Aye.
Ms. Garcia.
Aye.
Dr. Chawla.
Aye.
Ms. Brandvine.
Aye.
Dr. McIntyre. Aye. Dr. Kawaguchi.
Aye.
Mr. Moridomi.
Aye. Motion passes. All right, next item. Shara, is that 11?
Yes, let us move to 11. It will be a quick presentation. For this, we ask Nat Lieber from our licensing division and Mark Johnson from our policy advisor to unmute themselves and begin the presentation.
Okay, thanks everyone. Based on discussions that the DOC has had in the last year, the optician program statutes. This has been an ongoing project, I could say, for the DOC. They have met 3 times on this and have spent quite a bit of time working on these proposed changes. Staff has worked pretty extensively on this as well. We are just now starting to get some good public feedback. Of course, the letter from the National Association of Optometrists and Opticians, as well as some other feedback. So I'd like to ask Mr. Moridomi if we could perhaps give this back to the Dispensing Optician Committee for another look at a couple of issues relating to supervision requirements, fines, and some different definitions. And then once the DOC has completed its work, perhaps the Legislative and Regulatory Committee, now that we're going to be meeting again, can also take a closer look at it as well. And then we'll bring it back to the board after that's been done.
That's fine with me. I'd like to get input from the board. I must say, I'm usually not very happy when someone sends in a letter at 5 o'clock the night before, because I usually don't read it. I did skim through this one. I did have a question that was raised by the letter. I did have the same question that was raised by the letter, and that is why professional corporations were required as opposed to other forms of businesses. And I understand there's a memo or something like that, and I can take a look at that later. I've never heard of the National Association of Optometrists and Opticians. What is that? What is that? I've heard of. What organization is that? The optometrists can inform me later, or in their comments. So I did have that question. All right, let me open up to comments by other board members. I see Member Randvine raising her hand.
Yes, please. I just have two reading through. We define unregistered assistant. I'm wondering if we should define registered assistant. That's in the general provisions. It was the old page 80 prior to getting the additional documents sent to us in the final version. And then in section 2252, we speak to electronic mail. And if we have that in for dispensing opticians, do we need to update the optometry statutes to enable electronic mail for our optometrist community? So just two quick comments.
Do we have any other comments by members of the board? Dr. Kawaguchi.
So via the Ledge Committee, I was able to review this current draft, and I did have several points of feedback that I wanted to make sure that the DOC would be able to see at their next committee meeting. And so I just wanted to make sure that there's a format to be able to provide the feedback that I had given.
Chair Garcia, you're the chair of that committee. Is there a way that Dr. Kawaguchi can convey those comments to your board, your committee?
Yes, it would be great if maybe we can do it through staff, if you want to present it ahead of time before we meet, or join into we're going to have a meeting next month, whichever works for having those comments to us. We would welcome them.
I had provided the feedback via our COVID-19 Ledge remote meeting, and I submitted that to Mark. So Mark Johnson should still have that on his email dated April 17th. So Mark, if you could just forward that on.
And I would just ask, I apologize, Dr. Kawaguchi, if legal counsel could just ensure for us, are we able to make that a part of the materials for the DOC committee, just as any other public comment might be made available to them? Or do we have any issues? It's also being heard today. So I think, along with meeting minutes, we would want to include meeting minutes of this discussion for the DOC, but then I think also by reference, we would want to include Dr. Kawaguchi's email so that they might see specifically his comments and address those as well.
That sounds like the way to do it.
Yeah, I don't see any issue there.
Dr. McIntyre, I think you were next.
I just wanted to point out a couple of sections where I didn't like the verbiage. I thought it needed to be clarified. I'll point out what those two sections are. I can provide the change in verbiage if desired. It doesn't need to be here. I can submit that to the committee for them to review. But the first one I wanted to bring to our attention is on page 131. It is part of section 2550. It's a subsection F. I'll read it so you can understand where my problem comes up. It says ophthalmic lens or ophthalmic device means any prescription lenses, spectacles, eyeglasses, contact lens, plano contact lens, and other ophthalmic devices ordered by a physician and surgeon or optometrist that alters or changes the visual powers of the human eye. The problem is that list contains plano contact lens, which inherently does not change the power of the human eye. So we would have to add something in referring to if it comes into contact with the ocular tissue such that vision or the eye health can be affected. I'll be happy to submit that exact verbiage later.
Thank you.
And possibly just a refiguring of the list might make it clear that that modifier that changes the refractive power, that the plano comes after that modifier, so that it's clear that it is not modified by that statement.
It's
So this,
a simple grammatical problem.
exactly. But that's just something, someone will take that and do something with it if you don't make that very specific. The other was page 146, section 2564.76, subsection 2C. It can be easily misinterpreted. I'm getting to that page. A seller shall not alter any of the specifications of an ophthalmic lens prescription other than the color, or substitute a different manufacturer, brand, or other physical property of the lens. Grammatically, you can misinterpret that to think that the color or the manufacturer, brand, or other physical property of the lens could be altered. It depends on how you read it.
Right. Okay, thank you.
I interpret it both ways, but we just have to make sure that's very, very clear. And that's it.
Thank you. Dr. Kawaguchi, before I go to you, let's see if there's anyone else who wanted to make a comment. I don't see anyone else. So, Dr. Kawaguchi, yes, go ahead.
So a broader comment that's not in my already written comment related to unregistered spectacle dispensers. So we are currently going through an occupational analysis, yet we're making potential suggestions on how to word the regulations prior to that. So I would just ask the DOC to be mindful about decisions to change those things when we haven't completed our occupational analysis.
If I may, Mr. Vice President, Mr. President, just want to make sure that there is the clear distinction that within these optician statutes, these are assistants to opticians. So there are, technician programs or folks who are able to be overseen by opticians. And those are a different set of people with a different set of responsibilities from those who are unlicensed assistants to optometrists. So here within the optician statutes, we are not discussing the folks who will be a part of the occupational analysis next fiscal year. That pertains only to those who are unlicensed assistants for optometry.
Are there any other comments from the board?
Yes, I do.
Oh, I'm sorry, Member Garcia?
Yeah, I just wanted to make sure, I have noted these, but I would imagine in the agenda and in our DOC meetings that these we'll be able to have these notes so that the rest of the committee will get what Dr. Kawaguchi, Dr. McIntyre have shared with us. And if there's any other comments, I would imagine they will be available for us, right?
Shara?
Most definitely.
Yeah, okay.
Most definitely.
Yeah, as indicated before, we will supply meeting minutes, and then with reference, we will include Dr. Kawaguchi's earlier email. And if Dr. McIntyre would like to detail out the suggestions that she has, we will also include that in the materials for the committee.
And Member Garcia, on behalf of the board, would you thank the members of the DOC for their work? I know it's probably going to be frustrating to see this back on their laps again, but these are important comments, and we want to put out a perfect product in the end. So thank you for us.
I will definitely tell them that you're all very grateful for the hard. They have worked very hard for these. So, but I'm sure they'll welcome it. And as you say, we've got to make sure that everything will flow good when we're ready to vote on it.
Right. And if someone disagrees with them, as I imagine from one of the letters that they will disagree with some of the positions, that we want to be solid and have good reasons why we agree with the DOC. All right, I don't think a vote is necessary on this item, so let's move on to the next item. I'm guessing that should be item number 6. It looks like we may want to take possible action on this one, Madam Executive Officer.
So in fact, number 6 is not, there's no action needed. When we prepared the agenda with legal, we wanted to make sure that we had an opportunity for the board to take action if they indeed wanted to. And I want to make sure that we recognize that we actually haven't taken public comment on the optician statute review.
I'm sorry.
So we should return to that.
Very good. Thank you. Moderator, would you open the floor to public comment to the optician statute discussion?
Yes. I have now opened the question and answer panel to receive public comment. If you would like to make a public comment, please click on the bottom icon with a question mark within a square located at the bottom center of your screen. You're sharing instructions. In the ask field, typically in the lower right of the WebEx screen, type, "I would like to make a public comment," and send it to all panelists. We do have a few, and the first one is Christine Schultz. So Christine, I will let you know when you have been unmuted. All right, Christine, I have unmuted you. You have 2 minutes to speak.
Great, thank you. This is Christine Schultz with California Optometric Association. I have a comment related to the unprofessional conduct provisions. It's section 2555U. That's what I'm looking at. I have concerns with the term examination. So the way it reads, it says basically failure to refer to an optometrist or a physician if an examination of the eye indicates a problem. Well, since we don't, opticians and unlicensed individuals aren't doing an examination, I think observation would be a more appropriate term. Additionally, I also wanted to just strongly support the increase in the cost of the fines, the amount of the fines. The board really lacks the ability to do a lot of enforcement in this area because bigger companies can just ignore any fines that they get. We know that non-resident contact lens companies routinely ignore the law. We have Hubble that changes brands all the time. We have refills that are expired. The expired refills are always filled past their expiration date. So really appreciate the board looking at this and increasing the fines in this area. Thanks so much for your time.
Do we have any more public speakers? Moderator?
Yes, we have Joe Neville, and he has been unmuted. Joe, you're unmuted. You may now speak. If you are speaking, we are not hearing you. All right. If Joe, you may want to go to the top of your screen and click on Communicate, select Audio Connection, and select the call-in feature. All right. Joe Neville is unmuted, but we cannot hear him.
It appears that the communication wasn't set up.
Can we move to the next speaker and then go back to Mr. Neville after?
Actually, he's the last speaker,
I
so
see.
there's
Okay.
no one after him.
If I may, Mr. President, I would like to note that Mr. Neville is the signatory on the National Association of Optometrists and Opticians letter. So we do have at least some of his comment on the PowerPoint slides that we have here. I think there were some clarifications that you were looking for, but we can, of course, also take that up within the DOC committee meeting on the 18th of June.
Right. I don't necessarily want to cut him off, but we have given some time to allow him to speak. We appreciate having the letter. This is why it's a good idea to have a letter. Council, is it all right if we move on from this item? We've attempted to have the speaker speak, but there are apparently technical difficulties.
Was he able to type into the Q&A? That way, maybe he could type his question.
He was able to type into the Q&A, so Joe, if you would like to type your question.
Or comment, I should say.
Right, comment, thank you. And I am not seeing anything appear.
Okay. Why don't we move on to another item? If he is somehow able to get onto the system to speak.
I'm sorry, he just typed, just wanted to introduce the NAOO and we'll follow up later.
Okay, very good. Thank you very much, Mr. Neville. All right, let's move on to another agenda item. Shara, help me find my way and get me on track.
I think our next most important piece of business would be to approve the board minutes from February 28th.
Member Brandvine.
I just have a request to change, and I forwarded this already into board staff, and it was regarding my comment, Ms. Brandvine. I would like to change to read, noted that the rate increase process is a comprehensive and lengthy one. Requested that the board look into what other fee increases the AG's office anticipates over the next year and add to our radar, so when we plan our next budget, we can account for any further or anticipated rate increases.
Staff, were you able to hear that? I had.
Yes, and we also have written comments submitted by board member Brandvine. So we will be able to. I think the motion can include the amendment to the minutes so that the record reflects board member Brandvine's comments as submitted to board staff.
Do we have any other comments from board members? Corrections, member member McIntyre, excuse me.
I went through the minutes and made some substantive changes. I just wanted to apologize to Mr. Robbie Sumner, who was a guest at our last meeting, and in many areas his name was incorrectly spelled Summer, S-U-M-M-E-R, and in some areas it was correct. It was Mr. Sumner, and I just wanted to take note that his name is Sumner, not Summer.
So you're making that correction to the board minutes?
Yes.
Okay.
So wherever we've listed Summer, it should be edited to read Sumner.
Do we have any other corrections or comments on the board minutes? I don't see anyone else. Am I missing anything? All right. Then I'll entertain a motion to approve the minutes.
It's Dave. I'll motion to accept the corrected minutes.
We have a motion by Dr. Turetsky to accept to adopt the minutes as corrected by the previous board comments. Do I have a second?
This is Dr. Wong. I'll second it.
Dr. Wong seconds. Moderator, can you open the floor up to public comment?
This is the moderator. I am opening up the Q&A panel. It is now open and should be visible in the lower right-hand corner of your screen. If you would like to make a public comment, please type "I would like to make a public comment" in the Ask field and send it to all panelists. We have further instructions on the screen.
Do we have any public comment?
We do not.
All right, could you close the Q&A, please?
Yes, I can.
I think we're ready for a vote.
Okay. We'll start with Dr. Wong.
Aye.
Dr. Turetsky.
Aye.
Ms. Salazar-Sperber.
Abstain.
Ms. Michelin.
Aye.
Ms. Garcia.
Aye.
Dr. Chawla.
Abstain.
Ms. Brandvine.
Aye.
Dr. McIntyre. Aye. Dr. Kawaguchi.
Aye.
And Mr. Moridomi.
Aye. Okay, great. Shara, next item.
Just a note from legal on the abstentions. I take it that those board members who abstained didn't vote because they didn't attend the last meeting. That's fine. You're not required to do that. Your vote here to approve or not approve the minutes is essentially your attestation that the representations of the board minutes that you reviewed are accurate to the best of your understanding, and there's no typos that you came across as you were reading them, that sort of thing. So while you're not required to vote at all, like for example, if we had an issue with quorum, you may wish to vote approve on those items.
Thank you. That's a good reminder. It's 4 o'clock. I know some of you have to run to catch a flight back home. Oh no! You're already at home. Cheryl, yes, Dr. Turetsky.
That we need after that.
Just a quick question. So it's 50 feet from my kitchen to my office. How do I bill mileage for that?
No. There's been a 10% reduction in overall expenditures, and that's going to go under it.
Dave, what about your lunch? I thought you were going to build your soup and sandwich from your kitchen.
I will.
President Mordomi, I think if we want to quickly go over item 6, essentially it is like a hand carry into the room. The board has been made aware of client privileged communications, and then we have on our presentation today for number 6, the public-facing measures that we've taken to consider probationary requirements during the COVID-19 pandemic.
I think that's wise. I know Cherie has worked really hard on this, so I'd like to, and it is an important issue that the board needs to know about. So why don't we turn to item 6?
And I believe, Madam Moderator, if you would be so kind, we will need to promote staff member Matt McKinney to panelist in order to present this item as well.
Thank you. I will do that now. Matt, you have been made a panelist. You can unmute yourself when you're ready to speak.
Hello. Okay. One. So we're just kind of giving some information on how the board has been responding to some specific probation terms that have come up as challenging during the government's stay-at-home order, executive order issued due to COVID-19.
Can you try getting closer to your microphone, please?
Yeah, I don't know if that's better. It's pretty much in my mouth now. So
it's much better.
So some of the specific terms that we found to be problematic included community service, biological fluid testing, and hours worked per month as a requirement within the scope of the profession. Probationers were additionally contacting us and to let us know about hardships with paying cost recovery and probation monitoring fees since they were currently unable to work due to the order. So we kind of worked with legal counsel to review probation orders for current probation orders and what kind of discretion was given to us by the disciplinary guidelines to work with probation orders to find options for complying with their terms. And we've used some of that discretion to consider the governor's stay-at-home order due to COVID-19 when deciding whether to seek further disciplinary action based on the probationer's inability to comply with specific terms of probation. And just another thing to note is that the probation orders contain a mechanism by which board staff can consider financial hardship when a probationer is unable to pay required costs in a given month. So thank you.
Shara, is that it?
Sharia, I want to make sure that you have an opportunity to add comment if needed. And then we can take questions from the board.
I think that Matt covered everything great.
Thank you. Members of the board, do you have any questions or comments? I do have one question just for clarification's sake, but I'll let the board members speak first.
It appears that Dr. Kawaguchi has raised his hand via the raise your hand feature.
Oh, I see that now. Yes, go ahead, Dr. Kawaguchi.
So I guess my question is, depending on how long the stay-at-home orders last, are we considering, and do we have the ability, based on the governor's approvals of different changes, of tolling versus forgiving certain probationary requirements? So as an example, if a probationer needs to provide proof of community service and they are unable to, how are we addressing that?
So I don't know if you want me to answer, Shara, or...
I think
Glenn, that's precisely the question I was going to ask. If there's someone who has, say, 3 years probation and has to do, I don't know, 50 hours of community service, but the crisis lasts for another year, what happens at the end of the 3 years and they haven't done their community service?
So I think that what we'll ask is that legal counsel give comment on this. It really gets to the very clear definitions of tolling and then the board's discretion in order to choose to not display or pursue probation, enforcement terms.
Yeah. So simply because we have a stay-at-home order, doesn't let us, extend the time period in the term of probation. Say, for example, in your example, they have a 3-year probation, and let's say we're in stay-at-home for 1 year. That doesn't mean that it's going to take them 4 years to get off probation. They're still going to be off in 3 years. So what we're doing essentially for these type of terms that are very difficult, if not impossible, to enforce during this time, using our discretion on a case-by-case basis for items that are really facing, such as there. To answer your question, yes, directly, at the end of the 3 years, there may be certain probationers who have not completed those community service hours. Now, I would think and hope we still have, probation monitoring can work with the probationers to try to find ways to make those up, to get those done. They can do them telephonically. That's great. But they may not be able to. I don't know the details. But they're definitely pursuing, alternative means of compliance. That's one of the focuses. But yeah, I mean, we can't require them to do this if possible. Community service is open.
Well,
Mr. President, if I may, I just would like to direct everyone to bullet 5 of the PowerPoint screen, and I'll read it as well. The board board staff has the discretion authorized by the disciplinary guidelines to consider the governor's stay-at-home order due to COVID when deciding whether to seek further disciplinary action based on a probationer's inability to comply with specific terms of probation. Particularly on fluid testing, there have been some modifications that have been offered by our vendor. They are oral testing, which is the least comprehensive or least long-term testing, and it's done through basically an online a platform such as this, whereby the probationer would scan the room to show that there is no one else in the room with them, and then take the swab, place it into a container that's sealed and watched by the vendor's agent, and then mail that in a closed and sealed envelope that would be identified. We have concerns with the validity of those tests, but we are on a case-by-case basis determining if there is a strict need for there to be at least some sort of testing for individual probationers.
So as a follow-up question, I don't know that as a board member, I would need to see every specific probationer example, but I think at future meetings, it would be good for the board to know what's going on in some kind of summary report about how many different types of exceptions have been made, what kind of categories they've been in, just so we have a sense of what's going on.
That is a prudent request. I think that is something that we could provide during our next closed session.
I mean, stated another way, I want to make sure that although I have supreme faith in staff, I want to make sure that the board, that the staff is not being too harsh, and putting the hammer down on these situations. And so, if a probationer misses a requirement, what happens next? Does that probation have any recourse to the board, or is there any reporting to the board?
So I just want to, as an example of our intention of working with each individual probationer, as I said before, we have the possibility for action on this agenda, and it had been our intention to ask for guidance from the board to make a motion, but we really did feel like that overarching approach wasn't appropriate for our 8 probationers. And so what we've done is to really take a look individual by individual, making sure that they're aware of their ability to submit financial hardship paperwork, understanding that folks have made a good faith effort to try to find volunteer opportunities, but have not been able to find an organization that will work with them, or having had an established volunteer relationship with an organization and being told to stay at home at this point. So we really are being very thoughtful about the individual probation terms for each probationer and how that fits within their situation at this time in the COVID pandemic. And we are certainly using that discretion to not pursue additional enforcement action when we know that probationers are making a good faith effort to continue to improve within the profession and provide the care that we know is really needed to protect consumers.
Thank you. Do any other board members have any questions or comments? I do not see anyone else. Does staff need any further direction on this, or can we move on to the next item? Oh, after we take public comment.
This is the moderator. I will open up the question and answer panel. The question and answer panel is now available. If you would like to make a public comment, please type "I would like to make a public comment" in the Ask field on the lower right-hand side of your screen and send your comment or request to all panelists. And no one is asking to make a public comment.
All right, if you close the Q&A.
We'll do that.
And we'll move on to the next item. Madam Executive Officer, if you could look and check and see what we've covered and not covered.
Certainly.
And also, after you do that, make an executive decision as to what reports or items you want to submit on the basis of the reports that you've submitted and what items would require further discussion or comment by the board.
Certainly. So we have not addressed items 5B and C, but unless there are questions or comments from the board regarding the enforcement program report or statistics or the examination and licensing programs report and statistics, we could submit that. We have submitted that to the board and made that information available to the public. If there are no particular questions from the board or from public, then we could move and have sufficiently addressed those two items.
So I'll ask the board members, does anyone have any questions or comments related to those two items of the executive officer's report? I see a hand raised by Vice President Kawaguchi.
So this is related to licensing and the fact that the report showed that the number of applicants that we have at this point is lower than we typically expect. In the past, we've had the luxury of being able to present at the California schools to help the about to graduate students to understand the process and encourage them to begin the process as early as possible. I'm assuming that we didn't have that luxury this year. Did we submit any alternative communications via the schools to get to the students to help them through the process?
So we did actually have the opportunity at Berkeley. Our licensing lead at the time was able to give a virtual presentation aided by Dr. Wong. And we have also been working very closely with the other school and college dean to provide them information about the need for, beginning your application, taking the CLRE, getting your fingerprints done, and then the communication that we're receiving from NBO regarding those. What we've really found over the last 2 years as I've been here is that fourth year communication isn't what's most important. It's really the third year communication, because what we really want for our applicants to do is to begin their application for examination to take their CLRE at least a year before their graduation. That way they have multiple opportunities. As you'll recall, we require a 6-month wait, partly due to our test question bank. So if you fail the CLRE a year out, 6 months later, you have an opportunity to take it again. If you then fail again, then you're here at crunch time, where we are now, taking your examination. So those folks who are in fourth year and just now submitting their initial applications are doing themselves a disservice, because quite possibly they might have to wait 6 months to take the examination again. So we did have a good deal of communication with now fourth years, but at that time, third years, about the need to begin your application as soon as possible. And then we did have the opportunity to present at Berkeley, and we have worked very closely to disseminate information to Western and to Ketchum.
Could we also post an FAQ that has front face to our website, so that way if those potential students, maybe from even other schools, don't have that privy, that if they go to our website, they can see there's an FAQ related to, are you going to be seeking licensure in the state of California? Here's what we know around NBEO testing. Here's what we know about the access to our CLRE. Just something so that we don't have to deal with lots of calls coming through to our office.
We do currently have an FAQ on the website, but we can post it more prominently on that front page, along with our other COVID-related alerts and communications.
Do we have any other comments or questions by board members? I don't see anything. Moderator, can you open the floor up to public comment?
Yes, this is the moderator, and I am opening up the question and answer panel. question and answer panel is now available. If you would like to make a public comment, please type that you would like to make a public comment in the ask field in the lower right-hand corner of your screen and send it to all panelists. We have further instructions on the screen.
Board members, amazingly, we still have 23 individuals attending our meeting.
Are they all awake?
Don't know. Although I'll give points to, or I'll give CE credit to all the board members. You've stayed awake throughout the entire meeting.
Have we?
I've been watching.
I actually, that brings up a very good
You
point.
can't see me, Mark.
I want to make sure we have had some inquiries from folks regarding the ability as other licensees to get CE credit by participating in today's teleconference and video conference. We unfortunately are not able to provide the standard that we have asked for, and that we are not able to maintain a record of attendance in order to know that folks are, we are engaged and in the room, so to speak. And so we are not able at this time to give CE credit to licensees who have been with us today. We appreciate it, and we hope that you understand that your comments on each of these items have been incredibly valuable to the board. But unfortunately, because we are not able to maintain the standard of taking attendance as we would, we are not able to give CE today. Within our current regs, we are very clear that you are able to get only 4 hours of CE credit for the 8 hours that you attend, and you need to alert board staff, sign in at the beginning of the meeting, and sign out at the end of the meeting. We did try to find ways in which we could maintain that standard for this meeting, but we were not able to. We do commit as staff to find ways to provide that for future teleconferences and video conferences for our licensees.
Thank you, Shara. Do we have any public comment on this item?
No, we do not.
Okay. Can you close the Q&A portal?
Yes, I'm closing it now.
Thank you. I think that completes all the discussion items on our agenda. Madam Executive Officer, is that correct?
Yes, we just have item 14, future agenda items, and item 15, adjournment.
Okay. So future agenda items. I was reminded a few days ago that we are due for board elections. So, but because of the crisis of the times, we haven't gotten to that. So I assume, Shara, that's going to be an item on the next agenda?
That is our intention. We have also been very considerate of the fact that we have several appointments that are in their grace period. So we have both our assembly appointed member and 3 gubernatorial appointments that ended their term last June have now come to the end of the grace period. And we're not getting an indication from the governor's office or agency as to what their intention is. We also are still vacant for the Senate appointment. So we, of course, want to stay within the guidelines of our handbook, but I also want to allow there to be some discussion among board members about the need for those potential new board members to be a part of the accountability and the elevation of executive officers.
Hey, I have a question regarding that. So does that mean for those of us whose our grace period hits on June 1, that we're no longer, unless we're reappointed, we're no longer on the board?
I would defer to council. My understanding is that it is the 1-year grace period or until someone has been appointed to the position. But we can solidify that and make sure that we're understanding. So there is some concern that members who are beyond grace period may not be able to have valid votes in future meetings. But there is also the possibility that simply because the governor hasn't taken action, your vote might still be valid.
Yeah, I'd have to research that issue. My inclination and my experience is that after the grace period year is over, then yes, as you indicated, you wouldn't be a board member if you weren't reappointed. But don't hold me to that. I'll research and get your definitive answer. But that's what I'm.
Yeah, I would not guess on this. I've
Well,
researched this in the past for other boards, and you'd be surprised at how long expired board members can serve on boards.
Good.
Any other possible future agenda items?
I just want to know, did you
Yes.
just call me expired? Wow.
Okay, you're beyond your best used by date.
Wow.
That sounds even worse, Mark.
You can stop now.
All right. Any other future agenda items? We've already put a number of items on the plate. But yes, Dr. Kawaguchi.
So at our last board meeting, we ended up hearing a story from a doctor about her trials and tribulations of an expired license that was very difficult to reactivate. And we had at the time decided that we wanted to have that as a future discussion item in last board's meeting, and we didn't have a chance to bring that to discussion for this board meeting. So I want to make sure that we keep that on the table as a discussion point. I think she raised some points where there may be more difficulty in getting relicensed than serves the consumer. So I just want to make sure that we don't forget about that.
We have in no way forgotten about that. We have continued to review her file. It's in fact goes back and forth with me. I keep it under lock and key when I am at home, but we are continuing to review her file and review our processes in order to make some recommendations on how we will change in order to make sure that those sorts of impediments do not occur again. We have, though, been stymied on that particular initiative as we've had to address COVID-19 and the questions regarding continuing education and other things.
Thank you, Glenn. Any other comments, suggestions by board members? I am seeing none. Shara, thank you very, very much for organizing this meeting. I thought, given the conditions, it went very smoothly. As David pointed out, we had record attendance, and we got through all our business. And I miss all of you, but thank you very much to you and staff, because you've kept us awake and kept us fresh.
Thank you. Just before we move to item 15, we want to make sure that we open up item 14, future agenda items, to the public.
Oh, yes. Moderator?
All right. This is the moderator. I will open up the Q&A panel. All right. The question and answer panel is now available in your lower right-hand corner of your screen. If you would like to make a public comment, please type "I would like to make a public comment" in the ask field and send it to all panelists. If you do not see this box, you can click on the question mark within a square found at the bottom middle of your screen. And we have instructions on the slide as well.
Any public comment?
There are no public comments.
Okay, would you close the Q&A?
I will, thank you.
All right, let's move on to item 15, adjournment. If there are no objections, I will be adjourning the meeting. Hearing no objections, the meeting is adjourned.
Thank you. Thank you.